You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices with Vicki McManus-Peterson and Dr. Chad Johnson.
I am so excited to be here with one of my most admired female clinicians, Dr. Nikki Green from Fort Worth, Texas. Nikki, how are you doing?
I am good, Vicki. How are you? I'm so excited to be here.
I'm excited to be here too. Before we got started, we talked about the title of this being Everyday Practices, Bringing Home the Bacon, and we're going to have a lot of fun here with this, I can tell.
We all want to do that, right?
That's right. So, Nikki, I know you through two ways. One, you've come through the Productive Dentist Academy, but also you've been a client of Gary Takacs for a long time. And
right.
you are, I want to say, a preeminent CE junkie. Like you actually, because you actually digest what you learn. And I love that a lot. So, to get everybody acquainted with who you are, can you tell us just a little bit? I know you've been in practice for about 16 years and you've owned your own practice in Fort Worth for about 11. So tell us what your practice focuses on and what some of your drivers are.
Sure. Yeah. So you got it right. I've been practicing about 16 years, owning my own practice about 11 here on the west side of Fort Worth. Our practice focus, we are a comprehensive adult dental practice, meaning that we take care of everything from everyday routine hygiene and routine care all the way up to full mouth rehabilitation. And even in the last 18 months or 2 years, we've really gotten into the all on 4 or all on 6, implant hybrid market. So we do it all. We have 4 dental clinicians within our practice. We like to say that we all kind of have subspecialties within the practice. I've got an associate that is fantastic at endo. If I was going to need an endo on my own upper second molar, I'd love for him to do it.
Which, there you go.
I wouldn't want me to do it. My husband is excellent at surgery and implants and wisdom teeth and anything surgery related. I've got a new dentist in my practice that does a lot of our routine care and may even start seeing a few children, although we're not really a pediatric practice. And then myself, my focus is more on comprehensive restorative and aesthetics. And then we all utilize things like CEREC and cone beam and all that kind of fun stuff. So we're comprehensively driven.
That is amazing. And Chad, I know that your practice is very similar to Dr. Green's as well. I think that's the great thing is to see how we have commonality across the country. We like to think about our differences, but there's a lot of things that we have in common.
Yeah, Dr. Nikki, thanks for letting me join in late here.
Sure.
I was just wrapping up as you do. So hi, long time no see in person, but
I know.
Yeah, I kind of do the same thing where I'm selective about which kind of treatments that I want to provide, not more or less just because of what I would prefer to do. And some clinicians choose things because of clinical acumen or preference or, some of the specialties that they have around that they'd prefer to refer to, but everyone kind of gets their own choice. And that's cool to hear that you've maximized your potential by doing what you want to do.
Yeah, I love it. It makes coming to work every day a lot more positive when you're getting to come to work and do what you love to do.
Right. Yeah, no, that's cool.
So, Nikki, if you don't mind, I want to dive right in there. You said it makes me want to come to work every day. Tell me, I don't even want to guess how much CE you've had in your career, like 5 masterships. How do you quickly get team buy-in and implement?
Yeah, that's a really good question. And I haven't always been really good at it. Sometimes I go off and I get really excited about something and then I come back Monday morning and then we're back to the old grind and it's hard to get those things implemented. So, for me, it was actually, if I was going to be the driving force behind all of that, it actually meant me cutting out some restorative dentistry days, like you're catching me today on an admin day. And I've had Mondays as an admin day for me for probably at least the last 5 years of my dental practice. And that was a big driver for why I had to do that. Because when you have to come back and you're immediately back into the mouth first thing Monday morning, and you're doing that 4 or 5 days a week, implementation was a lot harder. So
I think you and I were talking about that when we were in Scottsdale when I first met you. That was about that time. And
it was.
I remember asking, so do you have to go back to work tomorrow morning? And you're like, no, I think I'm sticking around another day and then I'll be back. And I was like, wow, that's really cool. So,
yep, exactly. Yeah.
Chad, let me ask you that. After that conversation in Scottsdale and you got that she had admin days on Mondays, did that change how you scheduled your time in your practice?
No, I wish I could have, but also there was kind of a financing necessity at the time. At that point, I was, I hadn't even pulled the trigger on my Productive Dentist Academy journey. And, I mean, that was great and all. I was like, man, I hope to be there someday. But no, I mean, just to be honest, I wish I could say, yeah, I went home and I implemented that right away. But no, truthfully, I thought, wow, that's great for her, but I just can't do that. I can't afford that. I can't swing that right now.
What did your schedule look like back then? How many days were you working?
I was at that point, if I recall, I was doing about 215 clinical days a year, and I was still just doing 4 days a week, but I think I might have done some Friday mornings. And it was at that point, it was 8 to 5 or 8 to 4:30, something like that. So a lot more clinically heavy, and administrative just had to come on Friday afternoons at best.
Sure. And how long, do you guys remember how long ago that was?
That's so funny because Chad remembers what I told him. Yeah, he remembers what I told him sitting outside at lunch in the blistering sun in Scottsdale. Yes. And I remember what he told me. And
tell me.
It was your split schedule. So you were telling me, so guess what? As of, last July, 2017, I implemented a split schedule, and it was all based on the conversation I had with you. So that's pretty funny.
That was, what though? That was later because we've met up more than once. And
well, we have, you're right about that.
And because I've done that in the last couple of years, where I started what I call my mitosis, my clinical mitosis. I'm taking one cell and splitting it into two.
You're right.
Basically 2 shifts. And recently it has been, and I've had a lot more success and more potential to be able to do different moving around of the schedule and whatnot. And it's made a lot of difference. I love being able to let the schedule be in my control as opposed to the schedule controlling me.
Absolutely. Yeah, that's pretty funny. And I think for you, the conversation maybe we had 5 years ago when I was telling you about admin days, that was before your PDA journey.
It was.
And when you were telling me about your split schedule, that was just as I was starting my PDA journey. So, and that's so true though. We learn more. I've always said you learn more from the conversations you have at a CE event than you really do from the people who are talking from the stage. Now you excluded Vicki, we learned oodles and oodles.
Oh, no. I learn more in the hallway than I ever provide on the stage. It's who you're surrounding yourself, right? It's those everyday. That's why we name this everyday practices, because it's like an everyday dental practice, but then what's my everyday personal practice?
Right.
And I think one of your everyday practices, if I had to observe you, is to be curious. I think every day you wake up and you're like, what am I going to learn today?
For sure. Curiosity. And sometimes it's a killer. In preparation this morning, just for because Mondays, I don't know about you guys, but as other dentists do start putting in more admin time, for those of us who have grown up doing clinical dentistry 4 to 5 days a week, where you have a set schedule, you need to be here and then you need to be here. Admin days are very difficult for me. Right. So I actually find myself having to do more preparation for my admin days than my clinical days a lot of times. And, my preparation this morning for an admin day took me 2.5 hours, and and part of that's my curiosity.
Do you find that you have to be a lot more disciplined in how you structure that day? So that way you don't
way
get
more
caught?
disciplined.
Yes.
Right. Yeah. Because my team disciplines me on the other days, right? They set the schedule and I just go where they tell me to go for the most part. Whereas, on my admin days, it's all up to me to be productive, and it's more difficult to measure the productivity, right? So you gotta, maybe if it's implementation of something I learned at a CE, then I've got to set myself some landmarks, that I want to achieve over the next few weeks, so to speak.
Hey, Nikki, so tell us, the listeners, why is doing well at business important to you as a person, not just, talking strictly clinical stuff, but as the bigger picture with a family and whatnot.
Right.
So tell me more about that. Why in regards to lifestyle is success important to you?
Sure. So, I think it boils down initially to personal gratification. I just get a lot of personal satisfaction out of growing things, whether it be my business, whether it be my son, whether it be my friend connections, my family connections, whatever that may be. I like to grow things. So that's been a big driver for me to grow my business. Secondarily, it is just having accomplishments, setting goals and achieving them. And I was doing some goal review, just the other day of where I am for this year, and we're on target, if not over, and I that gives me great satisfaction to know that we've accomplished that. And then, moreover, for my family, I have one son who's 15, and I want to model success for him, and I want to model being productive and getting things accomplished. And I guess I'm maybe doing that because he's actually sitting next to me right now as I do this podcast, because today is a school holiday and he is banding instruments. So
in honor of Columbus. Nice.
That's right. I bet Columbus at one point dreamed of banding dental instruments on his day off of school. So.
That's right.
So that's probably, and that is probably the bigger driving factor is, I want to model success for him. I want to create experiences for him. We've got a vacation plan that we're talking about right now coming up in the summer that, I want to be able to do those things for him. I was raised by a farmer father and a nurse mother. And, our biggest vacations was maybe, getting in the car and hauling off to the mountains for an extended weekend. So I want to create experiences for my son that were a little different than what I had growing up.
Say, let me ask you, Nikki, as a woman in dentistry, I kind of wanted to go down that path just for a minute. How is your interpersonal interactions with your team, and how do you see that also working out, especially in Texas, where there can be some bravado and machismo? For you being a woman in Texas, in Fort Worth of all places, how does that work as a business owner? And what are the strengths that you can more easily get to, and what are some of the weaknesses, if you can think of any?
Sure. I don't give that a whole ton of thought. I probably did earlier in my career when you're looking for excuses.
Yes.
So maybe earlier in my career when I was having team issues, and I still have team issues, don't get me wrong. We still have things, that are not perfect. The wheels do fall off from time to time, but, maybe earlier on when I was having team engagement issues and such, I would look to my husband, who is also a dentist, remember, and he is a dentist and manages and operates a practice 120 miles from me. So I would nearly use the excuse, well, it's just easier for you because it's easier for a bunch of women to work for a man than it is to work for a woman. And I kind of used that excuse for a while. And then I realized that no, it was really not a sex related thing. It was just, I wasn't being as good of a leader.
Yes.
And so, it became necessary for me to work on myself. So I've spent a lot of time doing that, and I'm still a work in progress. Trust me, the wheels still fall off.
Do you find it that as you mature, though, that also helps your perspective and that it becomes less of a factor?
Absolutely. Yeah, absolutely. So, and I think that's the case with anything that we may encounter that we may try to cough up to, well, it's because I'm a woman or what have you,
or one thing or another.
Or one thing or another. Exactly. Anything. You could throw anything out there and it would be appropriate. But, I've had very little pushback from patience. Even being in, I was even in rural West Texas for my first 4 years of practicing dentistry, and I've had very little pushback from patients being a female dentist. I think they're used to that in this day and age. Honestly, if I was going to say that there's a struggle anywhere in dentistry for female dentists, it actually might exist more in some of the CE communities, possibly. And that's even a stretch for me to say that, just because, women particularly, I feel like go through cycles in their career. There's a time when we're very family focused, very children focused, and we don't have as much time for CE. I consider myself kind of lucky in that regard because I only had one son. And so I do feel like even when he was young, I had a little bit more time for that than a lot of my female counterparts do. I have friends that, raising 3 and 4 kids, and I'm going, oh my goodness, how are you doing that? So sometimes women find ourselves entering the CE circuit a little bit later in our careers because we at least need to get our kids out of diapers. Before we can haul off and do that. And so maybe that creates a little bit of a burden, challenge of entry, possibly. Maybe they feel like they're behind the curve or something. And I would hope for any of our listeners that find themselves in that situation, they don't feel that way.
That's right.
Because one of my favorite things about going to CE is looking across the room and seeing a 70-year-old dentist, coming to learn CEREC for the first time. That's just empowering to me, whether that person be a male or a female. So I would hope that if there is any female dentists listening that are finding themselves entering the CE circuit, what they feel like is late, late, there is no such thing as late.
Well, just like, Dr. Chuck, or at least as an acquaintance, and from Illinois. And that was always his story was, man, he's 70 and he's at the time, and he's just, saying, why don't I pick up CEREC? And it was intimidating at first. And so many people are so proud of him because, he, in spite of the fact that you'd think that he was near the end of his career, now he's more invigorated than ever about doing dentistry, that otherwise he would have hung up the hat a long time ago. And I don't know if it was about 10 years ago that he started with that, but he's voracious in learning his technology now.
Right. Absolutely.
All that stuff.
Yes, I do know Dr. Chuck. So yes, I'm and that's one of the most inspiring things for me when I do attend CE is watching some of these, whatever the age or the time that they're entering into some of these new technologies and such. I think it's awesome. And it's great for their teams. It's great for their patients. And let's be real, it's great for their practice values. It's great for all of those things.
Yeah.
So Nikki, I want to dive into when the wheels fall off.
Uh-oh.
Oh, nice.
If that's okay. One thing that I see, and it came up in PDA last weekend when we do the doctors breakout and the team are, off without the doctors. And then, I'll meet up with the coaches in the hallway and I'll say, hey, Dr. So-and-so is really ready to move the practice forward, but she's afraid that her team is not on board with this. And the coach will always 100% of the time say, oh my gosh, the team is so on fire. They're hoping that the doctor gets fired up.
Oh, right? That's funny.
So I think you've probably seen that too. And you kind of tipped your hat a little bit there and touched on it with the differences between you and Bob and your teams, and that you just woke up one day and said, well, it's none of these excuses. It's that I need to be, a better leader. And oftentimes I'll do a surgical implant into the spine of doctors. We replace their wishbone with a backbone. And I'm just wondering, how did you discover your backbone as a leader?
Oh, that's a really good question. It just like most things, it came through hard experiences. So I can point back to a couple of specific experiences. One was, you mentioned that Gary Takis has been my coach, and he has been my coach for many years. Even prior to me starting to utilize PDA, he was my coach, and he came in, it's been about nearly 6 years ago now. And he came in first and did some just DISC training with me and my team, so we dove into our personality types. And I know this is hard for you to believe, Vicki, but I'm a high D. And
that's why you and I get along.
That's right. And he had a really, he said, he made a tough statement, and he said, one of the biggest things that can destroy an organization is an immature D. And I started looking around the room to see who he was talking about. And then I looked at the plot chart on the wall, and I think I was the only high D in the room. And I went, oh, shoot, I think he's talking to me. and so I thought, oh, I think I need to work on myself. So, and so that kind of started the journey. It started the journey into just, buying books. I'm an avid reader. And as my husband says, he says, I'm not allowed to say I read because I listen to a lot of them in the car, but I do both. So right. I started, downloading books on, just how to be a better leader. I'm a big John Maxwell fan, big Lencioni fan. Gino Wickman is my newest favorite author, so I just started, kind of diving into some of those things. Vicki McManus Peterson's book is pretty awesome too. Frustration. So anyways, I started reading, and then I had a difficult time in my practice when I thought that the answer to my next level of growth was going to be to bring in a partner. And so I brought in a partner kind of sight unseen, and it just didn't work, as many dental partnerships do, particularly when you don't do the proper amount of vetting. And so it just didn't work. And after a year and a half of kind of suffering through that, went through a really ugly partnership divorce, and when I started through that process, again, Gary was still my coach at the time. And he said, you really need to work on your emotional intelligence. He said, that's the only way you're going to come out of this, ahead. And so I did. I really started working on my emotional intelligence, and I came out of it ahead. Did I lose several $100,000? Of course I did. But I did not lose a single team member. And, I did not lose a single day of productivity, so, and did not lose any patients, so there was just a lot of good things that came out of it, but it had to start with me working on myself. So.
Wow. I think you just saved a lot of people a couple of $100,000.
I hope so. If I didn't, you can share my contact at the end of the show, and I'll continue.
That was my journey too, because most of my role models for leadership were men. And so I thought, I'm going to be tough. I'm going to, I'll just tell you what to do. People need structure. They need boundaries. It's my show. They're going to be happy to go. And Lordy, that wasn't true. So, I put myself, I think I spent like 2 or 3 weeks in Atlanta getting certification in emotional intelligence. Like reading the book was not enough for me, Nikki.
It wasn't enough. You're right.
No, I had to be incarcerated for a couple of weeks and interned and, reprogrammed because, I just grew up a scrappy tomboy. And
me too.
It wasn't natural. And now people are like, oh, you're just so sweet and kind. And I'm like, oh, really? I'm getting used to those words. I'm more collaborative now. I don't blow up like Mount St. Helens. Yeah. They used to call me Mount St. Vicky.
They haven't shared with me what names they called me, but I'm sure at some point, when it's a little further removed, a little further back in the memory banks, they'll let me know what my name was.
Yeah. Well, you just shared with me a really cool, not to shift the focus too much, but your husband, Bob Leedy, the dentist in Abilene, and Chad was not on here when we were talking about this. So Chad, his practice is 4 hours away from where they live. Right. So at some point they did a cost analysis, figured out it was more cost effective to buy a limo and have a driver. And then he can use those 4 hours of commuting each way for catching up on emails, his reading, his own personal time. Right.
Right.
So,
I actually talked about that with my buddy when we went up to Minnesota to hop on the train out to Montana a couple weeks ago. We did a Tesla test drive, and it's Tesla has capability for self-driving. Perfect. And we got justifying it in our minds. Vicki, as you say, I'm a master of justification. I'm a brute in training that I'm trying to justify, I could drive to work and it would just drive me there.
Your 3-year-old could drive you to work.
Pretty much. All you do is you put on the turn signal to switch lanes, and that's it.
Oh, you have to turn the turn signal? I don't even do that when I am in control.
If you want to switch lanes. Now, Nikki, you're in Texas.
Well, you have to ask Nikki what Bob named the limo.
Yeah.
Oh, okay.
Yeah. So our nickname for the limo is the Bacon Hauler.
Bacon. Yes.
For obvious reasons,
I love that. So who brings home more bacon right now, you or Bob?
Oh, Vicky, that's a touchy subject.
I'm not gonna.
No.
Is it
I'm
touchy
No,
because you kick
no,
his
it's not
rear?
touchy. No, I wish.
Ah.
So yeah, I wish. No. So Bob is exceptional, and he has. People ask us all the time, well, why doesn't Bob just leave Abilene and come to Fort Worth? I said because his practice is highly profitable. Why would he? That would be a dumb move on all of our parts. But
Yeah.
What's really funny is, we, obviously we share a lot about our practices. It's, when you're both dentists, that's just tends to be a lot of your conversations around dinner or what have you. But we don't share day-to-day numbers. We just really don't. But consistently for the past 8 years that we've been together, we share numbers, and we really sometimes only do it at the end of the year. And we will go back and look at our numbers at the end of the year.
Confessional.
Yeah. And so many of our numbers are within a couple of percentage points of each other. It's just comical how we must be super competitive, even at a subconscious level. Because if it's looking like, for instance, this is a year that if you looked at the first half of the year, it looked like he was just going to totally run away from me. Well, heck no, I'm not letting that happen, So third quarter was my biggest quarter ever, and it was significantly higher than what I'd set my goals at. And me and my practice manager, we have a goal of making our fourth quarter even bigger than that, and we're going to catch him. Damn it!
Good word.
I knew I would get your competitive. So
right.
if he's ahead of you on production, do you switch the metric and go, yeah, but let's look at collections?
Heck yeah, of course we do. Of course we do.
If that doesn't work, then you look at new patient flow.
Exactly.
Nikki, help the listeners know though.
Yeah.
What did you do for the third quarter that made a difference? And I know it doesn't mean just drill faster, but what kind of goals did you set with your team, and how did you voice that, and what kind of incentives? How did that work that you killed it in the third quarter just on your own volition?
Sure. So I'm gonna reiterate a point that you make. It doesn't mean drill faster.
Right.
And I do know that a lot of times when people are first exposed to PDA or hear just little bits of things about PDA, because I know this was my perception in the beginning too, is we're not all Bruce Bairds, And we think that he just drills faster. Well, he really doesn't. If you go watch him in a day, he is just very strategic about his day. And that, if I've learned anything from PDA, that's one of the big things that I have learned is about being strategic with my day and scheduling my days to productivity. So that has, in my history of owning my practice, that has been the biggest contributor to increased productivity, is just better and better and better scheduling. So anytime we have a jump, I have to give better scheduling some credit. So for this last quarter, you asked that specifically. Better scheduling is one thing I'm going to give credit to. Secondarily is a better focus on case acceptance. So I have a new practice administrator in my practice who, let me give this advice to the listeners: hire someone outside of dentistry. And just tell them what you want and get them to help you. So I call her title is my VP of Sales and Business Development. But I call her a lot of things. I call her my integrator. She's also one of my very best friends. I call her I don't know, you may have to bleep this out, but I call her my get shit done girl. I call her a lot of things. That's it. That's what she is. So, but she has been instrumental this last quarter in really working with my admin team, because her background is in sales. So I'm talking about someone who actually came from the retail industry. And so she understands customer service. She understands sales. She understands, talking to, starting with a phone call, to kind of get patients into a mindset of acceptance and making sure that we're getting the right patients in the door. And so she's worked really hand in hand with my admin team. And so I give really that pretty much all the credit for my last quarter's success. So,
that's great.
yeah, it's been awesome.
That's awesome. Nikki, you said you also have a younger dentist in your practice.
I
A dentist
do.
does endo. Bob comes in. So talk to me about how you mentor your associates, how you calibrate, how you coordinate your treatment planning so like the
Sure.
hygienist and the teams aren't confused.
Sure.
Got any tips on that? Any practical everyday advice on that?
Sure. I'll speak more to when I've done it incorrectly.
Okay, that's great.
So,
Yeah, let's hear that.
so I have had several different associates in my practice. They've all been wonderful. Really, I've had very little situations where an associate has failed. I really can't really speak to that at all. I've had, a wonderful associate that moved back to Minnesota to be with family. But when I have had what I would say is closer to failure with an associate would be when I did not do all the things that you just said. So I just brought them in and maybe let them, watch over my shoulder for a couple of days. And then I just started putting stuff on their schedule, that nearly always sets them up for failure. And then too, just kind of unleashing them onto new patients as well. That is one of the things that I think is really unique about our practice is we have a very unique new patient experience. And that was taught to us, honestly, through Gary. Again, we give him a lot of credit today, but he taught us a very unique new patient experience. And not everyone understands that. You're not taught that in dental school by any means. And that was one of the places where I have set my associates up for failure before, is just to, let them start seeing any and all patients who I think just needs basic restorative work, just unleash them on those new patients. And that set the patient, the team member, and the associate dentist up for failure many times. So I've done my last couple of hires, I've done a little bit differently. I've had them go through, and it did cost me money, but I've had them go through a pretty extensive mentoring relationship with the practice first. So Dr. Omar Gaber, who's in my practice, who does exceptional dentistry on a lot of levels, but he's the one that I was referring to, that if I needed an endo on my upper second molar, I'd let him do it. He spent probably a matter of about 6 to 8 weeks where he was doing very little clinical dentistry. So he was watching over my shoulder. He was coming in on new patient exams, having the luxury of 2 practices. We even sent him to Abilene to look over Bob's shoulder, learn from Bob, watch him do new patient exams. And then we just spent a lot of time talking about those things. So as I was getting ready to treatment plan a case, he would sit right next to me and I would tell him why I was treatment planning the way I was, ask for his feedback. He has a different set of eyes. That's one of the things I love about a multi-doctor practice is we get free second opinions all day long. So I would ask, his input. What did he see? And so we did that for easily 6 or 8 weeks. And what I even learned from that is even that wasn't quite enough time. So my most recent doctor that I've hired, Dr. Caitlin Flossie, she's brand new out of dental school, and I hired her on June 1st. And let's see, we are into nearly the second week of October. And last week was the first week that I really had her productivity scheduled. So last week was the first, and she had a day. It was the first week of really doing much in the way of productivity. And she had her first scheduled to productivity day, which was awesome. But she really went through nearly a 4-month kind of an internship with me. And, that was hard at first because it's hard to find a doctor that's willing to do that because, I'm just giving them a base salary and I'm trying to explain to them, the value of that mentorship and what they're going to learn. And of course, when you're first coming out of school, that doesn't seem very valuable. But we had a team retreat this weekend and she pulled me aside and said, you just have no idea how much I appreciate the mentorship that you've provided me over the last 4 months, and I'm ready to go. And I truly believe she is. She's ready to go, So, but it takes, it takes a special associate too, and I had to give her the compliment as well because, for 4 months of just kind of being a tag along, that's tough. But she has learned so much in those 4 months. So yeah, that's how we've done it.
I want to commend you on your commitment to your associates because
yes,
it's definitely, they say that knowledge without experience is philosophy. And
I like that.
I hear a lot of philosophy about how that is the right way to bring on an associate, but it's always said in air quotes, like in an ideal world, I would have them shadow me. And
Right.
so I really want to commend you for making that experiential, not just philosophical.
Right.
You're paving the way for others to know what's possible.
Well, thank you. It's not easy because, it is, as there's going to be a cost associated with that. There's even an exhaustion level associated with that. I mean,
Sure.
let's just be honest,
Yeah.
That's why most people aren't going to do it. Yeah.
Right.
Were there any aspects of it, like you videotaped or you archived so that the next associate you bring on, it would be even easier? Did you find any ways?
No, but I'm jotting that one down, Vicki. I like it.
Yeah.
One of the things that she did, I have to give her credit. So she is a learner. We're big believers in strength finders, and she is a learner. Yeah. That's one of her top 5 strengths. And that girl in these 4 months, I bet she has gone through 6 little notebooks, little notebooks that would fit in her scrub pocket. I gave her that advice day one. I said, get you a notebook. And I think she's been through 6 of them. And she would just write stuff down. And then she would go home at the end of the day. And she was that dental school student you really wish was your study partner.
Right.
She would go home and she would
I want your copious notes.
Exactly. And she would retype those notes. And I'm telling you, I didn't have to tell the girl anything, twice hardly. And she was doing hands-on stuff for me too. So, we do a lot of complex restoratives. So I was having her, making my temporaries, and I was showing her how I create the embrasures on a Smile Design case so that the papilla will grow back. And, just things like that took me years and thousands of CE dollars to learn. And, I was showing her that in these first 4 months and, got to the point where she could make me a beautiful set of anterior temporaries that went way beyond what she learned in dental school.
Mm-hmm.
This is a philosophical statement that I think you could put into action, but it would be a true gift to her and you and your practice if she would take those typed up notes and video record her thoughts about that, right? And just say, okay, I'm just going to video journal my experience here and get it down. If she could condense 4 months into about 4 hours and say, one of the greatest things I learned was about making the papillas, and that's all the difference in the world, and the anteriors. And on section 3 of my notes, it kind of outlines that.
Right. Oh, that's awesome. Yeah. Talk about intellectual property,
Well, and when you, it's almost like she's teaching, right? Because she turns on the video recorder, she's verbalizing it, and it anchors it so much deeper when you have to pass that knowledge on to the next person. So you could give her the experience of that simply by condensing it, videotaping it, and teaching it back to her.
That's awesome. I'm writing that down.
And then you've got, you may have to compensate her for that one, Nikki. That's going to be a golden book.
Yes, it will be. Absolutely. And then maybe we can take it a step further and she and I can, kind of do parts of it together a little bit.
Yeah.
That would be a lot of fun. That would be.
All right. Your book, man.
Yeah. Mentor and menteeing.
There's such a huge, someone in the DSO world said, there are problems that you just do it yourself because it's pretty easy. Watch a YouTube video, you got it. There are problems that you'd pay others to get their advice because it shortcuts and streamlines. And then there are problems that you would pay any amount of money in the world just to make it go away. And mentoring young doctors kind of falls in that third category for most dentists because they're not natural mentors. They don't have the skill sets of a teacher. They don't have the skill sets of adult learning. And you do. So you would be solving a huge issue if you could document all that.
I like it.
That's awesome.
Well, it's going to be a win-win for both of us, So, I mean, I don't think that I did it selflessly. I honestly think it's going to be a win-win for both of us. So
sure. And we get to see you in just a couple of weeks in Scottsdale.
You do. I'm excited about it. We were making
Thanks for going to Blue Sky.
Heck yeah, wouldn't miss it.
Sweet. We're going to have some chimichangas together.
No, we've done that before, haven't we?
Have you? Yes. Yeah. Well, I appreciate you coming on the show and letting the listeners come in. You've been awfully transparent as well. And if only people on a podcast could see your beautiful smile, that would make it all the worthwhile all the more. But I appreciate you joining us on the show today.
Thank you very much. Thank you, Chad. Thank you, Vicki.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with everyday practices.